Okay, this is part four of Prevent and Reverse Dental Disease from the book by me, Pete Rogers. So we're going to talk in this section today about how to improve immune function. And the first thing is to avoid the things that suppress your immune function. You can't avoid aging. And as you age, your body gets more fragile. Your immune system shrinks. The lymph nodes in your neck, they shrink dramatically. I've seen many tens of thousands of neck CTs and MRIs, and I do hundreds and hundreds of neck biopsies for lymph nodes. And I can tell you, the older the patient, the smaller the lymph nodes at baseline. And it's relevant because young people, they often get referred for biopsy inappropriately because they've got normal lymph nodes for a young person, but somebody's going by old people criteria. Anyways, high-fat diet's bad. Lydia Lynch, Irish lady, PhD, used to be at Harvard. Now I think she's at Princeton. She has a good talk over at Global Immunotalks. The high-fat diets plus being obese, it suppresses immune function. So that's bad. That's why if you have cancer patients who are fat, like let's say ladies with breast cancer, the fat ones, they do worse. Anybody being fat and eating high-fat diets, you're likely to have a worse outcome with a cancer patient because it's your immune system that removes the cancer. Okay, and that's also why some people say, why get chemo? It suppresses your immune system. Don't get me wrong, you're playing chicken with chemo, trying to wipe out the cancer before you wipe out your immune system, but then the cancer will sometimes come back and you don't got much of an immune system to fight it. Okay, so anyways, I think Neil Bernard had a good quote. He said, the immune system can't work in an oil slick, okay, which is an exaggeration of a metaphor, but it still makes the point. The immune system does not work well with high-fat diets. Our ancestors didn't eat those types of diets on a routine basis in general. Okay, acidosis. Well, if you have a lot of sodium, what is salt? Sodium chloride. The chloride displaces some of the bicarbonate, the pH buffer in the blood, and it leads to a low-grade metabolic acidosis. Animal protein is also bad. So I'm saying excess dietary salt, bad for the immune system. Excess dietary animal protein, I recommend no animal protein. I recommend no added salt for most people. The animal protein's got more of the acidic amino acids, things like methionine, cysteine, sulfur-containing amino acids, because part of their metabolism is degradation to sulfuric acid. And so you get a low-grade metabolic acidosis. That suppresses immune function. So the worst thing would be the typical American diet. Lots of animal protein, lots of salt, and it's very high in fat. You're going to suppress your immune system, and that helps the cancer to grow. Plus also it destroys the glycocalyx of the endothelium, the arterial lining, and that makes cancer cells more able to bind to those adhesion molecules sitting below the glycocalyx. Remember the mnemonic for the arterial lining is 666, okay? The first six is for 600 nanometers, the height of the glycocalyx, which is antithrombotic, has a zeta potential, negative charge. It repels blood cells, including floating along cancer cells. But if you wipe that out with the high-fat diet, it's caused to slough off by high-fat diets. I gave a whole lecture on that, on how high-fat diets activate neutrophils. They release the granules with myeloperoxidase. The myeloperoxidase is very positively charged, cationic, and it causes a collapse of the endothelial glycocalyx, the coating above it, like a bunch of trees above a hill. And then that has a negative charge on it. So once that is pulled down by the MPO and even sloughed off by the MPO and the matrix metalloproteinases, then what happens is you got these exposed molecules, binding proteins, things like vascular cell adhesion molecule, VCAM, and you have the potential that metastatic cells floating by can stick to them, okay? High dietary salt causes platelet activation to some degree, and the platelets can also coat the metastasizing cancer cells in your blood. And the immune system works by Braille. It feels everything. So if your metastasizing cancer cells in your blood are coated by platelets, then your immune system can't feel them, by Braille. So the metastasizing cancer cell can hide to some extent from the immune system. And it'll also now, with the sloughed out glycocalyx from the high-fat meals, it'll be more likely to stick to the endothelium and potentially then go subendothelial and grow into a tumor. All right, diabetes, that suppresses immune function in multiple ways. What causes diabetes? High-fat diet, so you don't want to eat a high-fat diet. Excessive stress. High-fat diets and diabetes, they cause a little bit of activation of the sympathetic autonomic immune system. So that adds more glucocorticoids because stress raises catecholamines, adrenaline, noradrenaline, same thing as norepinephrine, epinephrine, and cortisol. So cortisol suppresses the immune system. It also causes blood hyperlipidemia, more fat in the blood, which suppresses the immune system. Okay, so you don't want that. You want to avoid unnecessary stress. You're a cancer patient, you want to be as healthy as you can be, minimize your stress. Religious people are much healthier, in part because it helps to lower your stress. And also it tells you to be nice, and when you're nice, your life is less stressful. Okay, excess exercise can fatigue the body. Exercise is a wonderful thing, but you got to be careful not to overdo it, especially if you are trying to minimize your cortisol and catecholamines. So the exercise will help you, but you know, in moderation, especially when you're building up your endurance and strength levels. Sleep deprivation is bad because it's the same thing as excess stress in a sense. It raises catecholamines and cortisol, the cortisol being the immune suppressant. Caffeine is bad. Does the same thing as acute stress, raises catecholamines and cortisol. And that suppresses the immune system, so you can't fight the infection, you can't fight the cancer as well. HG from amalgams or from eating fish. It's bad for the immune system. Alcohol, bad for the immune system. You don't want that. Mitochondrial inhibitors, bad for the immune system. The immune system has to turn on and off. When an immune cell goes into a big wound, there's a lot of edema and it's hypoxic, it'll have to run on anaerobic glycolysis. But you want that immune cell to be able to shut off. And when it shuts off, it should go back into aerobic metabolism with oxygen, using the mitochondria, more efficient to make more ATP. And that helps to turn off its behavior. If it stays in the glycolytic anaerobic mode, it's more likely to be pro-inflammatory. And acute inflammation in general is a good thing, to resolve an infection, to heal a wound. Chronic inflammation in general is a bad thing, ongoing arthritis or tissue injury. Corticosteroid medications, they suppress the immune system. And they can also have weird results. If you stay on them over a year, you start getting these flip-flop mechanisms where you get glucocorticoid resistance in some parts of the body. And you can still get negative side effects from them, like obesity, excitotoxin effect on brain cells, but you can also get this paradoxical pro-inflammatory response in some areas of the body due to glucocorticoid resistance. Okay, immunosuppressant medications like corticosteroids, one example of an immunosuppressant medication, but they sometimes give immunosuppressant medications for autoimmune diseases, for example, for transplant patients. Transplant patient needs them, but a lot of these autoimmune disease patients would have a better chance if they started out by trying to prevent leaky gut. Chemotherapy also damages the immune system. Okay, so that was it for today, just talking about things that lower immune function. So by avoiding those, you'll have better immune function. So eating the low-fat, low-sodium, vegan diet, 100% organic, single-ingredient foods only, no alcohol, no tobacco, no marijuana, none of that crap, no processed food. Has to be organic to avoid all the toxic chemicals in non-organic food, the herbicides, the pesticides, etc. Has to be single-ingredient only, because if there's a second ingredient, they add minor stimulant flavor things like MSG, MFG, etc. And no caffeine. So anyways, that's how you improve immune function and get your sleep. Hope you found that helpful. And also, positive things. Be religious, have a sense of purpose, have meaningful social relationships and interactions, maintain your social support system, enjoy nature to the extent that you can. Biophilia, being around all the green light, that improves mitochondrial function as the red light reflects off of it and then has a positive effect on mitochondria, probably changing the phase of the fluid in the mitochondrial matrix around ATP synthase from gel to liquid. So anyways, hope you found that helpful.